If you have a Medicare supplement plan, you can change it any time of year. Any time of year, not only between October and December. That's for Medicare Advantage, private Medicare, and drug plans. With the Medicare supplement, you can change any time of year. Most people don't know that. And then it depends on your state if you have to be able to answer the health questions, if you're healthy enough to change. So any time of year, but if you're in a certain state, you can do it even when you're sick around your birthday or the anniversary of your part of your policy. So for example, it's taken over the West Coast and it's spreading this way. So if you live out there, if you live in a state that's red, that means you have a rule where you could change your Medicare supplement plan. You could get a plan of similar or lesser benefits without answering the health questions. So the vast majority of the country, 30 states, you can only change your Medicare supplement plan if you can answer the health questions. Well, a lot of people think they're like, I have some things. I've got high cholesterol, high blood pressure. I take a water pill. I might have diabetes controlled with, metformin. You can probably change your plan. You don't have to be squeaky clean to change your plan. You just can't have the big stuff. Now, this does change between Aetna, Cigna, Mutual of Omaha, United Healthcare, on and on and on and on. They all ask different questions. So you might come to me and say, hey, my husband has Cigna. I'd like to get a Cigna plan too. But you might not pass their health questions, but you might pass Aetna's health questions. So they all ask slightly different questions, and that can change from year to year. So let's just talk about we'll just talk in general, one company. Have you been hospitalized in the last year? Almost everybody asks you that. And if the answer is yes, then you can't apply. So I tell people, when were you hospitalized? And they're like, 9 months ago. Cool, we'll wait 3 months, then we'll apply. Have you been confined to a nursing facility? You're never going to change it with any company. Are you bedridden or confined to a wheelchair? Do you use an assisted device like a walker or a cane? Nobody's going to take you. So I don't have to look at all the different insurance companies' rules. I can tell you right now, nobody's going to take you. In the past 90 days, have you received home health care? That's a question that will vary by company. Have you used oxygen in the last year? Some might say in the last 2 years. Some don't ask that question. In the last 2 years, have you been advised or been urged to have a surgery that has not yet been completed? Everybody asks that question. In the last 2 years, have you taken medicine for heart, coronary artery disease, high blood pressure, high cholesterol, on and on, all the cardiac stuff? Now, just because you say yes doesn't mean that we call that a knockout. A lot of times I have high blood pressure. That's okay. They want to know what it is. If it's controlled, what you take for it. And then typically that's fine. What happens is if you take somebody that has high blood pressure and diabetes, the two combinations together, many insurance companies won't take you. Again, this depends on which insurance company you're applying for. But in general, people are not going to take you if you have COPD, other pulmonary disorders, Parkinson's, Lou Gehrig's disease, Huntington's, MS, the very big diseases. No one will take you with those. Nobody's taking you with AIDS, Alzheimer's, dementia. If you have kidney failure, if you're on dialysis, you currently have cancer, including melanoma. You already have an amputation. Rheumatoid arthritis, that's a big one. You can have arthritis, don't have the rheumatoid arthritis. So there's typically over 100 different questions that they're going to ask you. And we know a lot because we've worked with so many different insurance companies. So the Medicare Family is licensed with over 60 different insurance companies. And you can come to us and you say, hey, my Medicare supplement has really gone up, right? They go up 5 to 10% a year, whether you use it or not. And at a certain point, it gets pricey. And you say, could I possibly get the same plan I have now at a lower price? Wouldn't that be nice, right? Often you can, but you won't know if you don't call us to check. Like I said, if you have Parkinson's, COPD, you're on oxygen, you walk with a walker, you're not going to be able to change and get another Medicare supplement program unless you live in one of those states. So let's go back to that state where the red states are. California, Oregon, Washington, Idaho, Nevada, Louisiana, Illinois. If you live in those states, I don't care what's wrong with you. I don't care what you have. You are entitled by state law to change your plan. Now, typically, if you have a plan G, you can get another plan G. If you have a whatever plan you have an N, you can get another plan N. You're not guaranteed to go from an N up to a G. That's called an increase in benefits. So most states will allow you to go laterally, and they have different rules. So some states, like Missouri, it's a time period surrounding when you bought your policy. And in other states, like California, it's a time period surrounding your birthday. So if you are in one of these red states, you're in luck. You can change even if you have these health conditions. But don't miss that window. If you're in a blue state, then don't assume you can't change. If you have the big stuff, yeah, you're not going to change. But just because you're taking several medications doesn't mean you can't change. It pays to shop and see, because many, many times we save people lots of money that they had no idea they were allowed to change. So give us a call, book an appointment down below, themedicarefamily.com, or on our website, themedicarefamily.com. There's a yellow box in the top. You don't pay for an appointment. You don't pay extra if we sell you this plan or that plan or the other. You'll pay exactly the same as if you bought it from that insurance company. We're independent contractors, so we are paid by the insurance companies. We don't bonus anybody, so nobody's incentivized to try to sell you one plan over the other. We want to research the plans that are available in your area, cross-reference with the qualifications, and try to help save you money to get you the same or better benefits. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question. Always feel free to call us or email us at the Medicare Family.